Okay, good morning, everyone. I'm Russell Myers, CEO of Midland Health. This is the briefing from the Unified Command Team for Tuesday, April 7th, 2020. You'll notice I had a mask on when I came to the podium, and we'll discuss the new CDC recommendations for masking in the community in just a moment. But first, I'd like to give you a few numbers. In the state of Texas now, well over 7,000, actually almost 7,300 cases in the state. In Midland County, the state's database says 24 cases. I think we may be up to 27, actually. It's a little bit of a lag in reporting. 140 deaths reported across Texas and 1 in Midland County. Testing at the hospital, or from the hospital's testing site, has improved pretty dramatically. We've tested over 500 patients now, and only 35 results remain outstanding. All of the long-term backlog has been removed. That did not result in a lot of new positives. We only have 22 positives that have come from the 500 plus tests that we've administered through the hospital's various sites. Hospital census activity in the hospital itself, overall there's 115 patients today, still less than 50% occupancy. The emergency room had a few more patients yesterday at 103, but still well below what we typically see at this time of year. In the hospital itself, there are 16 patients in critical care. 4 of those critical care patients are persons under investigation with suspicion of COVID infection. We have 18 of those persons under investigation in our newly established 30-bed COVID unit in the hospital. So the medical surgical population is now 18, the critical care population is 4, for a total of 22 persons under investigation in the hospital. Of those 22, I believe only 2 are positive, confirmed. 3 of those 4 patients in critical care are on vents. Total ventilators in use is 10 in the hospital of our 44 complement of full-service ventilators. So still ample capacity remaining for ventilators, critical care space, and overall hospital capacity. This morning, I'd like to offer a little bit of recognition to our materials management team. Every day, every conversation begins with the adequacy of our personal protective equipment supply. It has been steadily growing through the work of our creative team in materials management, finding new sources, assuring that those sources of gear are legitimate. There are lots of them out there that are not. Certainly a number of Chinese manufacturers have sprung up that are not approved by the FDA and are not legitimate. We're being offered things from all over the world, and so our team has to be very careful about vetting each potential distributor. We have found masks in all different kinds of places, both the traditional American N95 mask and the KN95 mask, which are a little bit more abundant. That's the Asian version of the N95. Looks a little bit different, but still works. So praise and thanks to our team in materials management for the creativity that they've shown in helping us to find all the materials that we need to keep our staff safe. Now,